Let's bring him in. He's our good friend, Dr. Joe. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital. He's been part of this show for over 25 years with great information in the world of sports medicine. Joe, what do you have for us today?
Hey, Ray, I'm not so sure you're going to want to invite me in on this after you hear what I'm going to talk about today. This is going to be, I have some stuff that's a little complex. I wouldn't do this in just any audience, but you have such a well-informed audience. We're going to talk today about something that maybe is a little out there in the weeds, if it's okay with you. And one of the things, Ray, was the pure joy for Cleveland fans with Sunday. Finally, a little turnaround on the football side against a good team. But there were some things that took away from the joy a little bit. Is a couple of the most important players on the team with injuries. But I think the injury that was most unsettling, that I got all the calls about from family and friends, people asking me, hey, what's going on with the injury to JOK? You know that JOK's been playing so well, such a really important part of the defense and everything. And, of course, it was unsettling for a lot of people to see him on the field for quite a time and needing to be taken off on the cart and immobilized a bit. And so people are kind of trying to scratch their heads saying, hey, if this is a concussion, why would they treat that differently from a lot of other types of concussions? And one of the things I just really want your audience to know, just a couple of points, is that not all concussions are the same. They're very different. Just like knee injuries that can be an ACL or an MCL or a patellar dislocation, there are very different types of concussions. And the one that JOK had is the one that, for me, in 35-plus years, is kind of one of the most unsettling, one of the most concerning. But I'm going to talk about, there's actually 6 types of concussions. Yeah, I'm going to just briefly touch on some of these different types of concussions. They can be so different, and so many people think you have to have all of these symptoms, when really all you need to have is just one of the 6 different types of concussion. So one is known as vestibular. I know we've talked about that. It's a big word. It means dizziness. And the middle ear in the brain is where that dizziness, that center for balance is. And when people injure the middle ear and get vestibular concussions, they have dizziness and balance problems and blurred vision, and they feel like the world is spinning around. And luckily, in the last few years, we've done a really good job with some specialized physical therapists that treat those types of balance concussions. Number 2 is cognitive concussions, Ray. And those, of course, are the ones that we're asking a lot of questions afterwards for memory, for problems concentrating, for finding the right words. These athletes are like in a fog when they are concussed. And those cognitive symptoms can last days or weeks. And so we have neuropsychologists on our concussion team that help begin to try to get people to improve when we're getting into longer-term cognitive issues. Number 3 is oculomotor. Fancy word again. Oculo, though, of course, I think a lot of people know, is eye problems. So why do you guys check the eyes so much? And so we look for double vision, blurred vision, tracking problems. Their eyes just are not tracking well. And not every concussion has these. The majority don't. But if you do, many times if they continue to have some of these eye problems, we have eye specialists on our concussion team that help treat these athletes and people with concussions. Number 4 is migrainous headaches. They have really intense headaches. They have full-blown migraines with their headaches with the concussion. And these can last hours or days or weeks. And some of the meds that our neurologists use, our specialized neurologists on our team, but sometimes they have to use really stronger medicines to try to break that pain cycle. It can be really significant, even IV medicines in the emergency room sometimes to break that pain cycle of headache. Number 5 are mood disorders. And so after having concussions, some of the real significant problems that athletes have, they're moody, they're irritable, they're depressed, they're anxious. Some even want to harm themselves. And we know of a few tragic cases that have been out there in the literature where people have committed suicide after they've had concussion symptoms for a while. And so the mood disorders, we need to get sports psychologists on board early on to try to deal with the issues related to mood disorders. That's 5. Number 6 is the one we saw on Sunday, okay? So that's the one that we worry about when you're out there the most. They're called cervical concussions. And it's kind of a mix of symptoms that come from the neck as well as from the brain. And so brain injury concussion with injury to structures in the neck, structures like the spinal cord, structures like nerves that come off of the spinal cord, structures like even fractures of vertebrae. So we have to be really careful to immobilize these people, make sure that there's not a fracture. Out on the field, it's hard to make sure until you get x-rays. So they bring out the cart and they get these people to emergency rooms for evaluation. The early initial evaluations on JOK that came out as late as Sunday night and Monday were, from what I heard, that he did not have any of those structural vertebral injuries or fractures that put you at risk for even people that could be paralyzed from these things. But that's why we worry so much about these cervical concussions coming out of the neck. Many times this comes from a blow more to the neck and the head, and it's kind of a combination of symptoms from both of those two areas. And they're really concerning, and that's why people were holding their breath until we got some more information that JOK seems to be headed in the right direction. But there's a lot of different types of concussions. Sorry to hit you guys with a fairly complex story today, Ray, but what are some of your thoughts on concussions?
Well, they're tough to read, right? I mean, I'm jumping into your arena where you're the expert. When I see concussions, whether it be a high school athlete or college or pro athlete, I get a little bit worried just from your education with me, Joe, on how the multiple times can really wear and tear. And, on a related note, something we didn't mention was Denzel Ward, who left the game on Sunday, and they're saying he's in concussion protocol. And, Joe, I kind of lost track, to be quite honest, on how many times he's been in concussion protocol. And I worry about the young man. I mean, he's a terrific football player, but he's had numerous hits in the head where he's been in concussion protocol. And I know you're not privy to the x-rays and all that other stuff, but I have to sit and wonder from the outside looking in, when does he call it a career? Because it just seems like every few weeks he's back in concussion protocol.
You're right, exactly, Ray. And I mean, that is a concern we've talked about a little bit before. You're right also that I do not know the types of concussions, the extent of how severe they are, because I told you 6 different types, and I hope I made that point clear. That's why these are so hard to manage and so frustrating for medical people, because there's so many different types, and they present so differently. So I don't know what types of concussions he's had. I don't know the extent. So some of these clear up. Many do, Ray, thankfully, in 5 to 7 to 10 days. And you see people playing within a week or 10 days. Even in the high school setting, if kids clear the protocol within 7 to 10 days, they can get back out there and play again. But when you've had several, the big point with Denzel Ward and others is then it takes less impact to have another one. And that's exactly what you're talking about, and that's exactly what concerns us about this local young man that we all care for so much. Yeah. He's such a wonderful athlete to watch and a great athlete. And the same thing, people talking about Tua and others in the league. But locally here, we care so much about our local kid, and we'll see what happens. I delved into the JOK one today, but of course, I mentioned that the 2 of them being injured took some of the luster off what really was a fun Sunday of football.
Yeah, I agree with you, Joe. Certainly something to pay close attention to. And, man, I appreciate it. It's been over 10, 15 years that you and I have been talking a lot about concussions. In case you folks don't know, may have missed it, Joe has really traveled not only around the country, but he's gone global in education pertaining to the world of concussion. So when Joe is laying it out for you, this is a guy who has really taken upon himself and through his education and insight and studies to really learn as much as he can about the world, unfortunately, of concussions. And they're still out there. Joe, I think the NFL is making advancements, but you brought up something before the season even started. You wanted to see how many people would wear those concussion, I forget the name of those helmets. And I have to tell you, it might be 1 player per team is about what I'm seeing at most.
I was totally wrong on that. I didn't think a lot of people would want to wear those. JOK jumped right in, actually, interestingly. And so somebody asked me, hey, how do you get hurt with the... Well, that cap doesn't eliminate. It reduced the impact by about 10% if you're wearing it, 20% if both athletes are wearing it. But there were a lot more wearing them, Ray. You are absolutely right on that one. I was wrong. You were right, as usual, on that one, and more people are wearing them, and there is concern. We're still in another research study right now, so we're researching it, and all over the country there's research going on, and I keep telling you guys I think there's progress being made, but I really also want people to understand it's so complex and such a difficult clinical medical issue that even with all the progress we make, it's still a very difficult problem to treat.
Well, Joe, that's because it's a violent sport, right? I mean, football it's not two-hand touch, it's not flag football, it's aggressive, it's tackling and everything, so there's that fine line on where you go over and where you don't. And for many, many years, these players have been taught a certain way to play. They're learning a different way. I think we've done a good job of education and training a different way to play football. But the bottom line, and you see it every Friday, Joe, you see it Saturday and Sundays, football, whether we want to admit it or not, is really a violent sport. So we can certainly protect, but, you know, it's the nature of the beast, unfortunately.
But I want to mention one more thing, Ray, then, with that mention, too, is you come into our concussion clinic today, there will be 10 or 12 kids that are concussed in our clinic this time of year. It's just, so many kids. But many girls soccer players, kids who have been out there playing basketball early on, taking a charge, kids in other contact sports, too. And if you saw it, you'd be a little surprised because you'd think, oh, my gosh, all 10 of these people today are going to be football players. And that's not the case. There really are a lot of other sports, whereas our athletes have gotten bigger, stronger, faster. The impacts in all those sports that I mentioned that are contact sports, lacrosse and soccer and basketball. So we are getting concussions in a whole bunch of sports, and we still have a lot of work to do. So we're going to get back to work today and try to figure this darn thing out.
Well, Joe, that's a great point, too. The training process with the young athletes and the pro athletes has gotten so complex and so good that these athletes are getting bigger and stronger, and that's a lot of times where you see, I know a number of student athletes who went to school with my kids who had very bad concussions from the world of lacrosse. So you're exactly right, Joe. Spot on again is that, the world of concussion is just not football alone. It's the other sports. Football is the most popular sport, so that one gets the headlines, but it is everywhere, unfortunately. Joe, great stuff this morning, my friend. Always appreciate the great insight and education in the world of sports medicine, and we'll do it again next week.
All right, let's talk soon. Thanks, Ray. Have a good week.
You got it, my friend. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital, as I mentioned before, part of the morning show here on WAKR.